Alright, hi, my name is Hannah. I'm your student medical assistant today. I'm going to be showing you different examination positions. Okay, alright, so the first position that I'm putting my patient in is the sitting position. So first I'm going to take this out. I'm going to ask my patient to come up here. And then next I'm going to take this straight. And in this position, you can examine the neck and the head. Okay, so since my patient is already in the sitting position, I'm gonna have her lay down in the supine position. So do me a favor. Let's do that thing. So like that. Alright, and since she's in this position, you can examine the abdomen and the chest. Okay, so the next position that I'm doing is the Fowler's position. So first, I'm gonna ask my patient to scoot back for me. Okay. Lift up her legs and pull out this tray. Alright, lay back for me. Alright, so now that my patient is in this position, I can examine the upper chest, and I can examine patients with respiratory problems like asthma. Okay, so the next position that I'm going to be putting my patient in is the dorsal recumbent position. So, would you scoot back for me? Okay, lift the legs up for me. I'm going to pull out this tray. Alright. I'm going to ask my patient to lay on her back. Alright. Really quickly. Alright. I'm going to ask my patient to bend her knees. Okay. Spread them apart. And I'm going to fix the drape to where it's right here. And covering her completely. Alright, and in this position you can examine the vaginal and the rectal area, and you can also insert a catheter. Okay, so since my patient is already in the dorsal recumbent position, I'm going to put her in the lithotomy position. So first I'm going to take out my strips, take them to the side, kind of lift them up a little bit. Alright, ask my patient to move her foot. This. This. Patient, can you move your butt down? Okay. And then it's going to fix it. And in this position, you can examine the vaginal, rectal, and pelvic area. Okay, so this next position that I'm going to be doing is the prone position. So I'm going to ask my patient to lift up her legs. I'm going to pull out this and have a patient lay back for me. I'm going to ask my patient to roll over on her stomach towards me. Oh. Okay. Cover up my patient. And in this position, you can examine the back and the access of the hip joint. Okay, so the next position that I'm going to be doing is the Sims position. I'm gonna ask my patient to lay down. Lift up her legs. About this way. Alright, cover up my patient. Alright, and then I'm gonna ask my patient if she would please lay on her left side. And this side open. Alright. Keep this open like that. That one's down. Alright. And in this position, you can examine the vagina and the rectum. Okay, so since my patient is already in the prone position, I'm going to be putting her in the knee to chest position. So first, I'm going to ask my patient to bend her elbows. I'm going to ask her to lift her butt up, put in the knees. And to make sure that she stays covered the whole time, I'm going to fix this straight. You would lay down. Alright, I'm also going to give her a pillow just to make it a little bit easier. And in this position, you can examine the rectum and you can also perform a proctoscopic exam. All right, I hope you enjoyed my examining position guide. Thank you for watching.